This is a third of a series of programs that will be featured with the title in mind, COVID-19 Communities in Crisis. And we do know that the Black and Brown communities of Buffalo and across the country have been suffering in a very serious way, and that a disproportionate number of African Americans, Latino, and Native Americans and other peoples of color have passed away as a result of this virus. And the comorbidities, the poor health, the poverty, all of these factors have become very underscored during this time because, of the plight of the community. So we're so glad to have with us two fantastic uh, physicians. They are both perfect for the title Communities in Crisis because they are in the trenches. And let me just introduce both of them by way of a short bio. Dr. Jonathan D. Daniels, he is a physician in the field of pediatrics at Maine Tonawanda Pediatrics Integrity Group here located in Buffalo. He's a native.
Not for too long. Not for too long.
Right? That's the truth. Uh, he's a native of Buffalo all his life, and he earned his bachelor's degree in psychology at the State University of New York in Buffalo after attending Rensselaer Polytechnic Institute in Troy, New York. He graduated from the University of Buffalo School of Medicine and Biomedical Sciences in 1998 and completed his pediatric residency and training at the Women and Children's Hospital of Buffalo. Prior to being at the University of Buffalo, Dr. Daniels joined the United States Army Reserves, where he served proudly with the men and women of the 365th Evacuation Hospital based in Niagara Falls, New York, as a combat medical specialist. He attained the rank of specialist and is a veteran of Operation Desert Storm and the Persian Gulf War. He was honorably discharged in 1994 before entering medical school. Dr. Daniel is an active member of the community. He serves on a number of boards and associations. Most notably, he is the president of the National Medical Association of the Buffalo affiliate, and we're so glad he's here with us today. Along with him is Dr. Raul Vasquez. He's also very outspoken, as you might have already heard. He's a recognized leader and innovator in healthcare. He's known widely around the country as a graduate of the University at Buffalo School of Medicine and Biomedical Sciences. And he graduated from Fordham University from the Boogie Down Bronx. And he has been invited to speak at some of the most prestigious universities and conferences in the nation. He is the president and CEO of G Health Enterprises, and he's well known about his work around that urban family practice and G-Bond with his lovely, wonderful wife, Tony. And they have a fabulous family. They're celebrating their 25th anniversary this year, and we're just honored to have them both here. Dr. V he's known as Dr. V. He's a host of and been honored by many organizations. And recently he's been honored as the Business First Power 250. And so we're just glad these are like the right people to come into the space and to talk about, crisis and coronavirus and how our local medical physicians are just, so well suited to provide the kind of care and support around this vaccine that we need to hear about today. So welcome, gentlemen. Thank you for being on the program. We're going to use sort of like a radio show kind of a format, and you both have been on our radio show with the Center for Health Equity. So we're going to be, focusing on telling the truth today, and we want to really get into the weeds. So let's start with our babies, Dr. Daniel. A lot of people have children and they have elders, and especially during COVID, they're finding themselves bringing everyone into the same home. And there's all this noise about and study and information about how we should be sending our children back to school. And parents are not feeling comfortable about that while we know that children may not be affected as adults are from the COVID vaccine, they they could be carriers. So you're putting children in an adult environment with adult teachers and administrators, other families who may or may not be practicing as cautious as safety around the coronavirus, and they could bring it into the school, and then you're bringing it back to your house. How serious is this issue around development, childhood development? How important is it? How do you weigh that against bringing coronavirus into your house? Should you stay in a virtual environment if you can? Should you, really try to get your kid to keep that mask on and wash your hands a lot? I mean, how do we, balance out the risk between the development of your child and allowing your child to go to school?
Well, thank you very much for that question. And first of all, I would like to thank you for having me join you in this important conversation. I would like to recognize certainly our distinguished councilman and certainly my colleague, Dr. Vasquez. I think, when we talk about the community and balancing out, I think you framed the question right. It's basically balancing what we want versus what we need and what's prudent. And again, what may be different in Black and brown communities, and I don't want to speak for other communities, is that we see our houses are multi-generational. And so we see that we might have grandparents in the house. We might have mom and dad that are essential workers that are working, and other people are taking care of their children in our village, if you will. And so how do we protect that? What is what we want? And we all want our students and our young people to get back to school. I think that's probably something that everybody could agree on. But is it prudent and is it wise to do that, especially in a multi-generational house? And I think you have to balance those two things. So, my approach when I talk to families, depending on their specific situation, is to make that balance. If I have a 85-year-old grandmother in the house with elementary school kids that have morbidities, I'm not going to be eager to rush those kids back to school, quite frankly, because I know that even though the child may be okay if they catch COVID, but they could be asymptomatic carriers right back to grandma and granddad, the godparents, the aunts. So we really have to be very, very careful. And in addition to that, I want to take a step back. I'm always a little bit bristled, if you will, when I hear that kids can't get it. Well, that's simply not true. Kids can get it. I have children that have gotten it in the practice. And yes, it is true that the numbers are low in comparison to our adult colleagues. But if it's your child, your nephew, your niece, your grandchild, that's all you care about. And so we still have to be ever vigilant. So I think we can kind of return back to some type of normalcy. And I think part of that normalcy is the vaccine. But I would really be cautious and temper our want, if you will, to return everybody in just the same cookie cutter fashion. It's not going to be that same fashion for everybody.
Yeah, thank you so much, Dr. Vasquez. We've been hearing a lot about the long haulers, and I am imagining that you have, both of you have seen this in your practices, people who had COVID-19 early 2020, and now, they're in for their annual visit, and they're still wrestling with some of the languishing side effects of COVID. Can you talk about what you're seeing and maybe talk about what you're hearing from the NIH and others about the research that's going to be going on in this space?
I think, what we're seeing a lot of is, remember, just to go a little bit over the pathology, is you've got these clots. We've developed clots all over the body. And depending on where you were impacted by it, there's a post-COVID syndrome that we're going to have. I mean, we have people that have fog memories in terms of what's going on, a lot of depression and anxiety because of the panic during the actual process. Some people that have developed lung disorders because the pneumonia co-scarring and a lot of other things that happen. So we're following those individuals, especially we have a lot of diabetics. So injuries to the pancreas that make the diabetes worse, injury to vessels like the heart because of that coagulopathy. So clot formation. So you have heart disease. We've had people that develop kidney disease, that didn't have kidney disease now are experiencing that. So, I mean, everywhere that the blood circulates potentially is leading to problems. And I think that's what we really have to look at because yeah, we're going to get out of this. But, and I always say the biggest problem we have, so the vaccine is going to help with the vaccination, but you don't have a primary care force. You don't have enough Black and brown physicians in the community that are going to be there. And, you know, these communities have always been kind of left out. They're good to learn from, but we don't do a very good job teaching them. So yeah, there are hospitals all over the place, but we don't have things in the community. And I think that's going to be, especially with COVID coming, it's going to be a problem we're going to have to deal with. And the best way to do that is primary care. I mean, Dr. Daniels and myself are primary care physicians. And I think the schools are going to have to recognize to get more of us. We have programs like the post-bac program that, you know, it was beneficial, not to me, but my daughter and other providers. And I think we're cutting those programs, you know, which is crazy, where they should be expanded at this point. So I don't mean to say it's one thing, but yeah, COVID is an issue, but to work around it, it's not by cutting programs that may long-term improve that. Sorry for the long answer.
Yeah, that's okay. But you kind of jumped into another issue, and that is, and I kind of wanted to kind of circle with these questions back into primary care. But you just jumped it. So we're going to get right into it because that's what we do, right? So the idea that we need more primary care physicians, you know, and that really probably the best way to have handled this COVID-19 vaccine distribution would have been through primary care because of the potential underlying health conditions, because of the long haul factors, because every household, as Dr. Daniels was saying, is different. Have these conversations about, you know, should your child go back to school? You know, my mom's in my house, you know, having these kind of conversations, getting people back into the health home, you know, getting them back into the medical community that they know and they love and they trust their doctors. So before we really fully get into that, let's talk just a little bit about the vaccine, and then let's go back to that whole notion as to why primary care is an important component that should not be left out of the strategy around the vaccine. But let's talk about the vaccine itself. Tell us about the good news, Dr. V. What's the good news about the vaccine?
Well, I mean, the good news, well, you know, I mean, 26 million people have gotten 2 doses. I mean, so we have 1 million Latinos that have got it and only 836,000 African Americans that have got it. Native Americans, 241,000. So while, yeah, we got the numbers, we're getting some of it, we're still not where we need to be there. I think the pipelines are opening up. I think the J&J will be a game changer to a certain extent because it'll change in terms of the follow-up. You know, you got to chase people afterward. One shot will be good. The only problem that we have, there's going to be a lot of misconceptions. This is a little different. It's not the same virus. It works a little bit differently. But at least we know that with all the vaccines, death rates and hospitalizations are none. And I think that's the biggest thing for our community to know. And again, back to the primary care. There's going to be a lot of vaccine hesitancy. We have had a lot of people that want it, but then you got that other crowd that if we don't get involved with the herd immunity, we're going to have issues. And so what I say there is, I always tell people, if you got 10 people and 9 are vaccinated, we don't have a problem. If we have 5 and 5, and 5 do have vaccinations and 5 don't, we're going to have this thing mutating and changing. And, you know, the UK is taking over as the strand in the area. And what it does, which we don't know, is, so there's the spike protein everybody talks about. When the virus came out, this is how the spike protein was. Now the new one, it's open. It's changing to adapt. And so you're getting a new type of strand that will make the vaccine very difficult to work in some cases. So the sooner we push out the vaccination, the less mutations we're going to get. So that was.
So Rita, can I just jump in? There's a couple of things that I wanted to just really emphasize is that we have to, when we look at it, and Dr. Vasquez is absolutely right, we have to just look at coronavirus as a multi-system infection. So it doesn't just affect the lungs. So that's what we were talking about with you're getting other organ systems affected, kidneys, liver, heart, lungs, all of those things. And we know that the coronavirus loves to get in by way, maybe the lungs and the upper respiratory tract, but it doesn't like to always stay there. And
Right.
so that's just one of the things. The other thing is just from a pediatric standpoint, we have three players, as we say in the market. We have the Johnson & Johnson, which was just approved for 18 years and up. We have the Moderna vaccine that's for 18 years and up. And then we have the Pfizer for 16. So when we talk about to pivot back to kind of how does it affect families and children? Well, even if you have a 12-year-old, a 13-year-old, as of right now, we cannot protect you with the immunization. And I don't want to minimize that because the immunization is a game changer for us to get out of this in the long run. But it's still going to come back to the basics that you've been hearing from the very beginning. Physical distance. I don't like social distance because we can get into the mental health part of this, and we may. But I prefer the term physical distancing as well as mask wearing. And then, it's about supply and demand. We have, as of right now, even with the hesitancy, I think we have more demand for the immunization than supply.
Yeah.
And then we have to open up, okay, if we have supply, then we have access. So you have all of these competing kind of things that are going on. Right now, we have to get our supply up. President Biden just authorized yesterday for, I think, Pfizer to start making the Johnson. So again, hopefully as we start getting into the spring and in the summer, the supply will come up. And then at the same time, we still have to hit our communities to talk about the real concerns that they have about hesitancy.
Right.
And then certainly, our council people, we have to hit access. There should be access where, I shouldn't have to go one spot on Delavan and Moselle, but I can go to multiple spots. And certainly, I think we're going to talk about whether the primary care physicians should have that tool in their toolbox too. Just like the flu shot, right? You come in for a flu shot, I'm giving it to you. I can give you nasal or the injection.
Well, and I just want to add in terms of pediatricians are the vaccinators. I mean, as a family doc, I have a small percentage. I do 400 vaccines every month, and we're transmitting the data back and forth. We know what the impacts of these vaccines are. We've been doing this for a long time, and it's funny that primary care has not been involved. I've done 2,600 shots, but it's been for other people, not my own. And I think it's real important that we're the experts in it. This is what primary care is about. And I think not to be included in the process is not a good thing.
Yeah. So let me, there's so many questions that I have, and they're starting to come in the chat. So if you have questions, just put them in the chat, and we will certainly be doing that part of the program toward the end of the program. But let me ask you about mental health. Dr. Daniel kind of touched on it just briefly. We know that our elders are isolated. We know that we've asked our children from, 4 to 40 to be socially, physically distant. And we also know that, suicide ideation is up, suicides are up, homicides are up, and so we know that people are struggling, very short-tempered, even in the grocery store. So what are you seeing in your practice? And this is why, again, primary care, these are the questions that you ask every time we go to the doctor. We got to fill out those doggone forms, which ask you, have you thought about killing yourself? Have you thought about, are you depressed? So let's talk about that for a minute. And what the case that I'm making, why I'm asking these questions, the case that I'm making is this is why we need our primary care physicians involved, because you are seeing what everybody else is not seeing as a population. We're seeing one here, one there, but there's a population health scenario that has developed that because of your unique role in our community, you're seeing what others mightn't see. So let's talk about this mental health piece, Dr. Daniels, and then Dr. V.
So, just as we were talking right before we started the town hall, I've been practicing for 20 years, and I've never seen in such a period of time the increase in mental anxiety and of all types, of all ages, consistently. I would be willing to venture probably every day I'm talking to a parent about this particular issue. And it's tough. And I certainly see the longer that this is going on, the tougher it is for not only the parents, but the caregivers and the children and everybody that's affected. And so that's why I go back to, we have to temper what we want with what we need and be prudent in deciding both. One of the things that I think we need to recognize, and I don't know if it's just kind of a reflection of my practice, but I am seeing an openness in talking about that. Back a few years ago, maybe even 8-10 years ago, I wouldn't have said that we would have been open about talking about mental illness and anxiety and parents really seeking help for their children. But now I think there is kind of a slow kind of evolution that they're understanding that just like high blood pressure, just like obesity, just like those other medical things that we can physically see objectively, that there is a subjective component to our mental illness. And so what I'm trying to really encourage our parents to do, and certainly, is to still create that type of regimen and schedule. We know children that have a schedule, they do better, period. So what school provided was a schedule. You got up in the morning, you brush your teeth, you go to school, you come home, or you go to grandma's house or something, you do your homework, you eat, you have some fun, and then you go to bed and you repeat, right? And so what this virtual learning and this kind of hybrid model has done is this flipped that schedule upside down. And so our children are really suffering for that. So and you can see it from everything from sleep to the anxiety to everything else. So I'm really encouraging our parents, and they're doing the right thing, is talk to your provider about that mental part. Don't physical distance. Still try to create those social relationships, albeit very, very difficult, and still maintain a schedule. And I think that's the big thing. And if I was to give some advice on the mental illness, look for those aspects. Look for children that are becoming withdrawn, children that are becoming increase in emotional ability. That means they go from being angry one minute and being happy the next and quickly going back and forth. Look for those kind of subtle cues that they're becoming short-tempered. All of those things are things you're going to be really looking for to say, hey, something's not going right. And then just try to go back to the basics.
Thank you so much, Doctor. Dr. V, did you want to add anything?
I think for us, I've been doing this for 30 years. I've seen mental illness in the beginning of the process, and it presents in a lot of different ways. So people are going to come in, sort of, I'm forgetting things, I'm losing weight, I just feel tired. They don't associate it with depression. And not only just depression, but the bipolar situation, the schizophrenic, the substance abuse, all that's always been part of what we do in primary care. And I think we partner with Endeavor, so we do primary care and behavioral. It becomes important. The health home in itself, because we're managing people that have a lot of these conditions, and having that tie-in with a navigator really changes the game, because even with the social isolation, someone can reach out. You have someone that you can reach out. You may be, things make it worse. No food, no transportation, and binding with somebody, because we live in a third world country in some parts of Buffalo. I mean, you got to just go out there and see. And having that connection is really important to address, the depression. And a lot of individuals have it, don't even know they have it. And I think identifying, managing it, it changes people. And I think so. Yeah, I believe the social issue that happened with COVID really magnified this.
Yeah. Let me quickly get just one or two questions in, and then we're going to open it up. What about if you're pregnant and or if you have a cancer survivor, or if you're undergoing chemo, should you get the vaccine?
Yes. So the right now, in terms of 1C, so if you have cancer, if you're a transplant patient, if you're an HIV patient, if you had a splenectomy, all those individuals need to be vaccinated. The study, when the vaccine came out, 50 women were pregnant afterwards. They didn't know they were pregnant when they were part of the study. And that turned out pretty well. So right now, we definitely know that if you're pregnant, 70% of the time, if you get COVID, you're going to get severe COVID. So that's a real issue for us. And I think at this, while it's an emergency use of the vaccine and we don't have clear indications for it, if you're pregnant and you're in the front line in some way, if you're not vaccinated, it doesn't make any sense. And I think so that for what we've seen, yeah, you definitely need to be vaccinated. Talk to your primary care doctor. make a decision. But, the outcomes with COVID versus the vaccine, your risk rewards is get vaccinated.
Yeah, and you have to understand, I'm sorry to jump in. As physicians, we always look at the risk versus the benefit, right? So that's how we're trained. That's how our mind kind of works.
Yeah. Yeah. And then when I asked the question, you both started shaking because people may be listening in. You started shaking your heads off. I thought I was looking at bobbles.
Yes, sir.
Yes, get the vaccine. This is important to a lot of families because, you're bringing a baby into the world. You don't want to do anything to hurt that baby. So that's why I asked the question.
Let me add it another step is if you get COVID, one of the things that we do see in some cases is infertility. So the idea is to vaccinate. We don't want to see any of these issues develop.
Thank you, doctor. That's exactly, we're one person, I think, because everything I want to say, you already, you say it right before me. And this is the part of the case. This is primary care physicians should be involved. And this is why you want to get the vaccine, to avert a lot of the things that we've talked about, to avert that long haul experience, to avert the, unfortunate risks to your health, and we want to get over it. So if we get vaccinated, we get that herd immunity, we can get back to, communicating, we can get back to loving and touching one another, which is very important, particularly for our children, and we can get back to better mental health. All of these things are part of what our society's experience. All these things are part of what you're experiencing in your practices, and this is why we know that you are important.
And I want to add more is now if you get your second shot, like we know 2 weeks later, and you're around someone COVID, you don't have to isolate. You don't have to quarantine. And I think so. We're seeing hope out of this vaccine. So just a positive. Just go get vaccinated.
And then you get a card, right? And
yes. Well, but not only the card. So as we do it, it's uploaded to the NICES where we score. We have the database. So when you go anywhere, if you lose that card, they can always check. So if you try to go to Canada, they're going to check that database to make sure that card was not made up.
Right. So that's an amazing thing. So I think I want to stop now. I know Dr. Daniels has another obligation. He will only be with us for a few more minutes and before we close today. But I want to thank you both so much for being our resident experts. And thank you also for the work that you've done up to this point and before COVID and all the work that you're going to do post-COVID to keep our communities healthy. We really appreciate you. You are two doctors of color that I call on regularly, and I've never gotten to know. So I just want to thank you both for just being always present, always willing to bless our community. I thank you so much. So with that, I'm going to turn it over to Kelly. She's got the chat fired up over there. I think there's about 8 or 9 questions in there. So Kelly?
So the first question comes from someone in the group. They have an appointment today for their first shot. What will I be able to do after my first shot that I'm unable to do now? They're a retired senior living alone.
Go ahead.
Okay, you go.
No, I'm sorry. So my expectation is that anything that you did before the immunization, you can do after. Now, certainly, everybody reacts differently, and so what I advise, and I'll use my mom, who will probably get me for this, is that I made sure that after she got the immunization, she hung out around our house. It's a little too noisy at our house, but that's just in case she had a reaction. And so you always have to preference that or effect, I should say, from the vaccine. Everybody's going to be different, but the expectation is that you're going to be able to do everything that you did prior that you'll do afterwards, but just be cautious because you might have a little bit of a headache or muscle aches or fatigue or nausea or something else that you do want somebody that might be there with you in the house or very close by for you to just kind of check in on you. I'm sorry, Dr. V, go ahead.
No, that's it. Out of the 2,300 shots that we gave, if you get the first shot, the biggest thing you're going to feel is sore, at the site of the injection. But if you had COVID before, and some people had it, didn't know they have it, you develop memory cells. So after the first shot, you get fevers, muscle ache, and fevers of 102, 103. You really want to take Tylenol and Motrin. But the second shot, and Dr. Daniels will tell you, that's when you start feeling the symptoms. What we're going to find with the J&J is those are the symptoms you're going to have with the first shot. So you will feel fevers, muscle aches, all the things, and you're going to feel tired for that day. So I would not think of going to work, because when I got my second shot, I was down for the count, and I'm pretty active, and it took me a day to recover. So
I was a
little
horse.
different.
I kept going.
Yeah, you were good. No, I could, man. It knocked me and my wife down.
I kept going. I think I had meetings that day.
Yeah, you're a young guy, man. You're a
Is that-
young guy, man. You know, I'm a little older than you, man.
Yeah, I couldn't help but put that in there.
Which speaks to, how different people can react, right, to
Yes.
the vaccine. Thank you both. Our next question, in two parts. The first two vaccines that were released, Pfizer and Moderna, have been shown not to be as effective against the variants that are circulating, and possibly new ones that may emerge. Can one of you speak to that? And then, after most of the population has been vaccinated, does it make sense, if you've had the first generation 2-shot vaccination, to have a third J&J vaccination, or wait until, when the second generation Moderna Pfizer comes out?
So I think that with the variants, what we do know is we may not get the efficacy of 94%. And I think if we had these other viruses all mixed up with J&J, we'd probably be at the same kind of numbers, because I think the J&J did have the South African strand, it did have the UK and the Brazilian. So you saw the efficacy come down, which is where we're at. So those numbers are pretty good. I think if you did Moderna, I think you should stick, and they're developing, reconstituting whatever tooling they're going to do, but it's easier because they can just piggyback on the studies and really get you the Moderna. I don't know about the J&J and following up on the Moderna and the Pfizer, and that's being talked because the J&J has that adenovirus, and I don't know if that may trigger something that wasn't there. So we don't know the studies. I wouldn't do that. I would wait to whatever your Moderna and Pfizer, and they move pretty fast, how it gets retooled. The other thing is that Pfizer is already doing, and Moderna are doing pediatric. They're going 12 to 17-year-olds. So we're starting to get into that arena. But, talk to your doctor. I think your primary care doctor can guide you through that, because we're constantly reading on peer reviews. And, while the vaccine is good now for like 3 months, in the next will be good for 6 months, it'll be good for 3 years. And I see it being good for 10 years. So that's what I see going forward. So, but the studies and the data are going to tell us more. I'm sorry, Jonathan.
No, I really don't have more to add to that.
And you answered in the comments, it's recommended that you stay with the immunization brand type that you had originally. Thank you.
And the other thing is, make sure you don't mix things up. So if you had a flu shot, 14 days. Whatever you do, you don't want to do that. Now, one of the things, pediatrician family docs, is when you get your second dose, if nothing happens in 30 days after the second dose, nothing's pretty much going to happen. Because when we get vaccinations, if anything happens, it's usually in that 30 days after the vaccine that you'll run into any complications that we see. So that's the other good thing.
Thank you.
Let me hop in here, but so far we haven't had any complications that are to note. And that's,
no. There's been complications in terms of allergic reactions in
Okay.
about 30 cases. No one's died. They've used the EpiPen, but there's been no deaths.
right. But there's been deaths from COVID, right?
Oh, there's been only 28 million. No, 500,000. Yeah, 28 million people infected and 513,000 people died.
Correct. So
Again, which bucket do you want to
risk,
be on? Yeah,
yeah,
that's what Dr. Daniel says. We play. Which bucket do you want to be in? I like
Right.
the one that there's been no deaths. I don't like to play with
me too.
science.
I think I can work with being alive.
Yes.
Yes, right. That's right.
So after you're vaccinated, do you need to mask and continue to physically distance?
Yes, but
Yes. You should do that just because we all live in a community, right? And so we have to take care of each other. It's a village. You are your brother's keeper. Yeah. And so yes, the short answer to the question is yes, and yes.
And so then can you, having been vaccinated, can you give the virus to someone? Can you be a carrier even though you've been vaccinated?
So the studies, this is an interesting thing with the AstraZeneca. What they did was, and it was one of the only ones that did it. After every week, they would swap people and check to see if there were virus loads in them. And what you found with AstraZeneca is it went away. So you have two types of cells that respond to COVID. You got beta cells and T cells. And the T cells are the ones that really do the killing. So they saw that with AstraZeneca, so that you're not going to be infectious. I believe it's going to be a class effect. We still don't know. There's peer reviews going on, but I believe that it will not just kill it, but it'll prevent you from giving it to anyone in your household. And that's why it's so important to start out with vaccination.
Thank you, Dr. V.
I would
Dr.
like
Daniels?
to take this moment before we go to the next question. I'm sorry to say that our Dr. Daniels has to leave. He has another obligation. Let's give him a round of applause. You know, throw up your hands, do whatever you have to do. And thank him so much. We appreciate your time and your talent and also your willingness. So thank you. Have a wonderful day.
Thank
We'll
you.
certainly follow up with you at another time. We'll get you on the radio show so we can talk.
Thank you. Same to you. And again, thank you for having me.
All right. Thank you, Doctor. All right. Next question. Is there another question, Kelly?
Yes. Do you know how we're reaching the homeless population?
Yeah, that's been, that we're trying to create a mobile unit. I think with GBON, because we do have heart, we have patients that are homeless. We're as we get more vaccines, that's the target that we're going to basically do, and we're going to be on the ground. It's not going to, at least for us. I think the other entities, but the homeless population is important to our model. We work with behavioral groups, and we work with even with health home, entities that are under us. We're going to tap into that market to make sure we go out. The Johnson & Johnson may be better because it's a one shot. We don't have to be chasing people around. So those are the things as soon as that comes out that we're going to use in that scenario. But yeah, homeless need to be, we're all in this together, man. We don't look out for other people. It's not a good thing.
Thank you. And Pastor George, I see that you're here. I know you're in another meeting, but if you're able, because I know that you sit on multiple task forces, if you have any information about reaching the homeless population, feel free to jump in at any point.
I know that he's in another meeting and he's trying to,
He's on the meeting I was supposed to be on. So we're
Yeah,
both
right.
we have a conflict. I'm glad he's there. We'll talk later.
Right. Ask them about reaching the homeless population.
yeah,
And so then the other question, follow-up question to that, is the mobile unit to reach the homeless and those that are unable to travel to a location, which Councilmember Bowman spoke to, as well as you, Dr. V. Is that something that's a part of your plan, as you're moving forward, or how are you implementing that on your end?
No, I mean, the county also, they got care dollars. They were able to order a mobile unit, so they've got their own. We're trying to pick up our own with our own pockets to kind of make an impact there. So yeah, we're I'm looking to kind of get another 1 or 2 more mobile units, and we can station. We're actually going to go to the Native community up in Seneca also, in different parts, Lackawanna. As soon as we get the supply, once I get the supply, I mean, I'm equipping our people to do 500 to 1,000 vaccines a day. So we're going to be hitting hard, at least the areas we can touch.
Yeah, Dr. V, that's a couple of things that I wanted to ask you about as well. Kelly, if I could jump in. The one is, just if you could just kind of remind us how coronavirus gets into your household. So say I'm going to say worker, what's happening and how does a whole house get sick?
And so there's 2 ways. There's a couple of different ways, but remember, in the droplets, when you cough, this thing floats for 4 hours. And I think with the mutated version, probably 8 hours that it could be around. So you can either, so once it's there, you can either, for one, breathe it. And if you breathe it and it goes into your lungs, then you cause a cytokine storm in your lungs. And that's where all that inflammatory pneumonia kicks in. So those are the ones that appear really sick. those are the ones that if we don't care well, can end up on intubation and really have bad outcomes. Then you've got the ones that through the nose when they breathe and they have that impact. It goes more into the GI system. So they can be loss of taste and smell. Really not, they don't have all the they're more carriers. They're not like the other individuals that are really sick, but they'll have some symptomatology. And because it's in the nasal area, it's in your GI, it's fecal oral. So, they've done studies to notice that this has been in the stool for 26 days after most people have been infected. So if you're in the house and you're not following protocols in the bathroom, coughing, touching, it can stay, it stayed in plastic for about 2 days. It stayed in different areas that you steal 2 days. So if you're touching, you're not washing your hands. As you know, you touch your face about 150 times to 200 a day. And I tend to do that. So you got to really, the hand washing becomes crucial, disinfecting, wear a mask. That's how we try to instruct people when they went home, what to do when they came in, what to do while they were home, and when they left home, so that you're not using a lot of jewelry, other things that can really set you up to bring more of this stuff home.
Yeah. And so that's why the vaccine is so important. It really is.
It's a way out. I think for us, it's hope. And I think, I'm 99% vaccinated at our shop. We have 220 people that work for us. And now, it's been over a month. I feel comfortable. They're not going to be infecting other individuals. And it's just the right thing to do. I had it done. My wife had it, my daughters. So I'm a pretty good, I study a lot. I read a lot. So I'm not going to jump my family in there if I wasn't sure. And again, this tricks the body. It's an amino acid with a little fat covering. That's all it is. It's not anything that we've used. We've used other vaccines like flu that takes pieces of the virus. This does nothing like that. And it's been used for decades. It's not something that we're just starting to use right now.
Yeah. So then the other thing I thought would be important to talk to you about, because you've had involvement in these clinics. You've were over at Father Bell. You were up with the Native American community as well. What are you seeing? What has been your experience as a practitioner in dispensing the vaccine to the community?
I mean, people are scared, and I try to kind of talk them down. I mean, some get very anxious, rapid breathing, everything that you can imagine. And then you just kind of explain it. You give them the shots. You go through the things that we're doing. And I think after, especially town hall meetings for my staff was a good learning. I use that as a module. So when we're out there, we're doing a lot of the same things and answering a lot of the same questions, because 90% of the questions that I get are the ones that you're asking. Everyone's asking the same type of questions. And I think just teaching people through the process and what the benefits of the vaccine, and then you're okay. And then have them become ambassadors. So I'm saying now you can go out and talk to your friends and your friends, and I want to infect you with information so you get them to get vaccinated.
Thank you so much. Do you have a final question so we could bring our council member back on?
Yes, we have a point of clarification. The question around being a carrier after being vaccinated. So having been vaccinated, can you still carry, not from the vaccination process, but can you be a carrier of the coronavirus and infect others?
Well, that's what we don't know. We're waiting for the AstraZeneca, which hasn't been approved here, has shown that it looks like you're not going to be a carrier. I think peer review studies are actually doing now what they didn't do in the beginning with some of the Pfizer and the Moderna, where they're doing weekly swabs and they're seeing viral loads come down. So that's telling you that you're not going to become a carrier, but we can't tell you that. Just like we could say now, 2 weeks later after the vaccine, if you get exposed to COVID, you don't have to quarantine. We're still learning, but yeah, it's coming soon. But I believe, yes.
It's a new virus, right? It's about a year old, a little more.
Yeah, but what I worried about is that once the people, and this is why it's so important to map out where the people that had COVID to vaccinate them. Because what we are seeing across the country is the South African and the Brazilian they're going to mutate and they're going to take over with the other viruses. And people that had COVID can probably be reinfected. maybe a 5 to 10%. So that's why it's so important to vaccinate people.
Right. So you heard it from Dr. Vasquez. You heard it from Dr. Daniels. Get your vaccine. They've gotten it. I've gotten it. I believe in it because, I believe in life. So I think it's a really an important consideration. Weigh it out for yourself. I wanted to close out. I think I'm going to ask Councilmember Bowman if he would close out, and then following him, Councilmember Rivera with any thoughts or comments, remarks at this time.
Thank you, Rita. I just wanted to say, wow, this is, very educational, this town hall, and Dr. V and Dr. Daniels dropping knowledge and just being leaders in the community. I see you, Dr. V, on the news and media outlets, just, pushing this and trying to educate people. And also just remember, this is still around us, as Dr. V was saying, wash your hands, wear your mask, be safe, and let's live to fight another day. So thank you very much. This was a wonderful thing to be a part of.
Councilmember Rivera?
Yeah, thank you very much, Rita. Once again, I want to commend on choosing these speakers. They are just fantastic, very knowledgeable. What I gather from listening, obviously, is what Dr. Vasquez said earlier. We need to open the pipeline. And I remember those words stayed in my mind in opening up the pipeline. And the fact that primary care physicians are not involved in the decision-making process is a concern of mine, obviously, because many people go to their local physicians. They go there to get their flu shots, and yet they're not involved in, determining this vaccination process. So I thought that stood out very much, and certainly the mental health aspect of this that we never considered, the depression, anxieties, the fears, and everything that comes after you've had this, and the underlying things that will continue to be there, and the need for services for those effects. So certainly we need to do more. And as council member, the only question I had is what can we do, obviously, to continue to open up doors? And we'll continue to advocate, whether it's the Board of Education, whether it's pop-up sites, whether it's physicians and pharmacies. We want to make sure that these shots, those pipelines are open all over the city. And it's great what's happening on Delavan Grider. We'd like to see that at all four corners of the city of Buffalo, making sure that our community, especially the community of color and other vulnerable communities, are receiving their shots. And today I received the word of encouragement. To me, it was encouraging. There's hope. And that's the beautiful part of this. So thank you very much to Dr. V and Dr. Jonathan Daniel. Thank you so much.
Thank you, Councilmember Rivera. Thank you both, Councilmember Rivera and Councilmember Bowman, for your leadership. And so we'll be looking to hear about what the council will be doing to push further in these spaces with both our local county government and our state government, certainly even our federal government, where this vaccination is concerned. And I think the point around follow-up care, post-COVID care, is going to be an important aspect. Those who are healthcare providers who've been watching the death of over 500,000 people, and even in their own families, this is going to be an important aspect, not to mention those children who've lost their families, siblings, grandparents. There's just been so much death. All deaths are up, not just COVID deaths, but all deaths are up in the country. And so we know that that's going to be another place for healing and consideration going forward. Kelly, I want to thank you so much for your support, for your great backup support with the chat room, and Ebony Atwood. She's always fantastic with helping us with setting up these Zoom meetings. We want to thank her and all the members of the African American Health Equity Task Force who may be on the line. We'd like to turn your attention to buffalohealthequity.org. We have one more presentation on March 20th focused on healthcare providers. These are the assistants and support staff that are out there every day in people's homes and in the hospitals and in nursing homes, who are actually providing care, and they have a story to tell. So with that, we want to thank you. Turn your attention to register for that event, and please have a wonderful day. Thank you again, Dr. V. Have a great day.